Hi, everybody. This is Stewart Gandolf, and I'm pleased to have you attend our webinar today. Those of you who have been following us for some time will recognize Rob. We've had many podcasts together, live on the scene at Shizmet and HCIC and other places, and also over the phone. Today is our first webinar together, and I thought today would be a great chance to introduce Rob's content live so you can actually see some of the important work he's been doing. Rob has been doing a lot of research about COVID and actually will walk you through how this fits into a series of research reports he's doing. And so today, Rob is the star of the show. I'll be just adding some color commentary, but I'm looking forward to Rob take it away. And glad to have you.
Thanks, Stewart. Thank you so much. So I'm kind of Howard Cosell and you're Danny Don Meredith. Is that how we'll do it?
I think it's perfect.
Yeah, there you go. All righty. Well, thanks. Thank you so much, everyone, for taking time out of your busy and hectic days. We understand these uncertain times are really challenging for everybody. But there's also a huge opportunity as healthcare marketers and communicators and planners. There's a huge opportunity for us to really help our brand family members that are on the front lines right now, to help them ensure that there is a growing business and continued success after we get through this difficult time. So what I'm doing to help as a market researcher, what I provide is information and knowledge. That's what I do with my clients to empower them to help them make better decisions. So as part of that, I've embarked on a multi-phased market research study. It's a national online survey. We're talking to 500 consumers across the country. And I'm, unlike my normal omnibus that I do every year where it's one and done, here we're doing multiple waves. So this is actually wave 2. We did wave 1 in the 1st of April. Now early May, we just completed last week, wave 2. I'm going to do wave 3 sometime in June. And I'm actually considering doing a wave 4 maybe in August or September, because we all know how people feel today is not the same as how they felt a month ago. And it won't be the same as they feel today a month or two from now. So that's the real difference with this research is getting a more longitudinal look at how people's attitudes and behaviors are changing. Clearly, I really want to understand, are some of the things that we're doing now, say virtual care, is that going to stick? And what can we do to make sure that it does stick in consumers' minds in terms of innovative new ways to access care? So we're going to be talking about a lot of those things today. So again, I said it was an online survey, and anywhere you see arrows or bolds or letters, that just indicates a statistically significant difference. And I'll point those out when we get there. So let's start out with just kind of some of the some simple questions we asked folks. I just want to understand from their perspective where they feel we are on the curve, because the curve's been talked about everywhere. Where are we before the peak? Are we at the peak? Are we after the peak? So where do Americans think we are? You can see back in April, they thought on average across the country we were approaching the peak. Now, last week, most Americans feel that we're kind of just past the peak, or we're right at the peak. And that's a significant change. This is one that's more important to see over time than any one point in time. So let's talk about exposure to the coronavirus. Just like in wave 1 and wave 2, 3/4 of Americans don't know anybody that has it. So what's happening is 3/4 of the country, their emotional reactions and their behaviors are predicated more on indirect experience, meaning what are they hearing? So communication, whether it's news media, politicians from their hospital or doctor, what have you, they're getting a lot of messages thrown at them. And I can tell you there's a level of frustration of, I don't know what to believe, because it seems like there's an agenda, especially when you look at news media and politicians. Consumers are not really trusting those sources. And so you, as a provider brand, never before have you been this trusted. I mean, they're using the word hero to describe your organizations and the people that work there. That's an amazing piece of brand equity that we have that's going to give us the legitimacy to what we do after we come out of this. So what's really important, yeah, go ahead, Stuart.
Just some color commentary on that. And so Today in our webinar, we have a variety of different folks on the line from, pharmaceuticals and manufacturers, health plans, large practices, small practices, and hospitals. And I think that really, there's a halo effect across the board, don't you think? I know that you probably focus more on health systems with this report, but what are you seeing in the data for that?
Well, I'm actually going to get to that in a little bit, but there's not as much a halo effect as you might think. It's providers are really gaining the most. Pharmaceutical companies, durable medical equipment, health plans, the trust level is not there as much. They've got more to do to actually connect with consumers. Hospitals and doctors, and they're really nailing it right now. So that's kind of the state of affairs. So you can see here that 17% know someone who has corona, 5% say an immediate family member does, a household member at 2%, and 1% said that they have the coronavirus personally. And if we look over, have they been tested? 4% have been tested, but 3% said it was negative. Only 1% said that they tested positive. And their testing has really changed from drive-through in wave 1 at 16% down to 0 in our most recent measurement period. But retail clinics are back up. So the CVS's or the Walgreens of the world. So they're definitely having a very strong play in this. Retail clinics are, and hospital ER has been about the same. Doctor's office, it's gone way down. So you're seeing a shift from inpatient to either outpatient, urgent care centers, retail clinics. Those are where a lot of the testing is starting to shift to. And again, where will it shift a month or two from now? How have people been impacted at work? 16% are back at work, which is significantly higher than just a month ago at 12%. So we're already starting to see a little bit of going back to work in just 1 month. And have you been furloughed with pay? That's also up significantly, 5% from 2%. But furloughed without pay or fired or terminated completely, those have not changed over the month. But again, I think there's going to be a lag effect when it comes to things about work and insurance and things like that. That's why doing multiple waves of this will help us to understand where does that lag effect start to really rear its ugly head. But I'm definitely concerned that there's a lag effect when it comes to job status. I don't think we're seeing the full impact because of the economic shutdown. That's still to come. So we really have to monitor that. So let's get into kind of the meat of the thing. What are some of the behaviors that they're doing during the coronavirus? So I asked folks, we listed all of these different types of healthcare activities or behaviors, and asked them, what have you done? What have you started doing that's new? We also asked them, is this something you're doing now but you've done before? Are you considering it or are you not considering it? But I wanted to focus on just the percentage of people that said this was a new behavior for me, because I want to understand what behaviors in healthcare is the coronavirus changing. You can see here between wave 1, which is the gray bars, and the blue bars are wave 2, 2.5 times as many people, 12%, which is up significantly, said they had a virtual visit compared to wave 1. So just in 1 month, 2.5 times. And if you look at all the numbers that are being reported all around, hospitals and systems are going from maybe numbers like a few hundred virtual visits a month to maybe 12,000 a week. I'm seeing numbers that dramatic. So we are seeing a sea change in how people seek care. And I can tell you all the virtual work that I've done before the coronavirus is really showing that, as I say, time is the new currency. And so if you don't have a virtual care strategy, you're way behind the 8 ball now as a provider. It is here. We've now proven that we can innovate quickly. So in a way, we've almost created our new normal, Stewart. We've really said to America, you know what? We can put bureaucracy aside and we can adapt because of this. So now we have to keep adapting and innovating quickly because consumers have come to expect it. So I think that's a good thing. I think it's unfortunate circumstances, but it's given us the push that I think we needed as an industry.
Rob, I totally agree. It's funny, the hospitals being such a reputation for being stodgy, slow, political, nobody wanted to get on board. And these systems now with, thousands of doctors and staff and, you know, millions of patients, and moved and got more done in like 2 weeks than they were able to get done in a decade previously. And I totally
Yeah.
agree. Everything we've seen is it's not coming back, and consumers like it as well, which we'll probably cover. But that's really, really a major seismic change for sure.
Yeah, and the other thing that's important, that's a change, that's an unfortunate change, is mental health. Big rise in virtual mental health, and we're going to see a lot of people are converting from in-person therapy to virtual therapy, and a lot of people are starting. 7% of Americans had a virtual mental health session because of the coronavirus. That's a lot of people, and it's only going to go up afterwards. So as a provider and as a payer, having access to mental health sessions, whether it's in person eventually or still virtual, payers have to step up and make sure that a virtual mental health visit is covered the same for those mental health providers, is the same as an in-person. Otherwise, you're going to hurt them financially. So that's where a payer can come into play, is to make sure that they can offer the virtual mental health, because people are suffering so much right now, as we're going to see coming up in a few slides, that the emotional toll is almost unmeasurable with what this is going to do because of the financial toll. You know, my concern, we're going to see an increase long-term of suicides, bankruptcies, divorce, spousal abuse. All of those things are going to be a longer term that we aren't going to be able to measure for months or years to come, but we have to be prepared for that. So as providers, we cannot look at the coronavirus as something that just broke our body, that was a physical challenge. This is having an emotional, a spiritual, and a financial impact on people. And as providers, we have to step up and say, we see the whole person. We're going to take care of the whole person, not just fix broken body parts. So it's we want to have population health where we take care of the population as a whole. Now is the time we really have to step up for that.
Rob, just 2 quick questions. I know we're
yeah.
but one is, keep in mind as you're looking through this data, where are the opportunities? So great example later today, talking to a new client we have with a chain of behavioral health providers in the Northwest. And so that data is the kind of thing that inspires innovation, because obviously that'll be a part of our marketing plan for that provider. And they're working to switch from more Medicaid to private care, or private pay rather. So think about the opportunities as we go through this data, like how can you apply this in a new and novel way as an opportunity? Obviously it's a human tragedy, but from a business standpoint, where is that opportunity? And then number 2, if you think about the tiny percentage of the population that has suffered symptoms, you know, we said nobody even knows anybody who's had it. Most people don't know anybody who's even had it. But 7% of Americans, so most people, you know, huge numbers of people that are not directly impacted are suffering the ill effects mentally. So I think that's really intriguing. Go for it, Rob.
And I'm going to be getting to that in a few slides, Stewart.
Very good.
So again, this is a question we said, regardless of what you're doing now, what are you definitely going to do after, and we leave the after open-ended because we don't know, but after this situation abates over time, what are some behaviors you're going to continue to do? No surprise going back to see their primary care physician, especially with older people. But you can see virtual visits, 28% said they definitely will continue with virtual visits. And that's up significantly from just a month ago in April. So again, the opportunity for us to provide different access points for consumers. And we're going to see coming up too, there's opportunities with when we're open, you know, staying open late. So it's not just virtual care. That's one opportunity. There's going to be a shift in where people get care and with whom. So there's a lot of opportunities that I'm going to show you in just a few minutes of what we can do. Because the key is we need to come off looking like we are proactive innovators, not reacting. Consumers want a calm, proactive voice from us, whether we're providers, payers, whomever. They want to see that we've figured out what to do here long term. We're not just reacting in the heat of the moment. And so having a cool head and innovating and sharing with people, here's what we are doing. That's what people are really looking for us to. And I'm going to get into that in more detail. Interesting question here. We asked folks all of these different types of activities. These are non-healthcare. but I wanted to put this in just to kind of put in context where people's fear levels are. And this, we asked people, do you think when everything is over, you're going to go back to doing these activities immediately, after some time, 3 to 6 months, or you may not go back, or you just don't know. So the big challenge you'll see here, anything in red means that the wave 2 score is down significantly from wave 1. And the blue means it's up significantly from wave 1. So just when you look at shaking hands and hugging, things we've been doing for thousands of years as human beings, people are starting to head their bet like, you know, I don't know if I'll ever go back to shaking hands. And I'm not sure when I want to hug. When it comes to eating at a restaurant, shopping, going to the gym, place of worship, or going back to work, people are significantly less likely right now to say immediately. They're starting to say, well, maybe I'm gonna wait a little bit. So I think we're seeing a lot of Americans saying, even if you open things up, maybe I'm not going to be the first one to go back to a restaurant. Maybe I'll let it go for a while and see how that goes. So that is something we have to look into and be prepared for. Is just because we want them back and we're ready for them to come back from a healthcare standpoint doesn't mean they're ready to come back. We have to really make it comfortable for them. And we're going to talk about things that we can do to lessen their concerns that they have. I'll get into that in our the next chapter. So, but the point is, people are not as quick to say, I'm coming back for everything. So how do we get patients back? So we first asked which of these appointments or procedures were canceled because of the coronavirus. And the point is that's really interesting here is that there's a significant increase. If you look at that 66%, significant increase in the number of people that said, I had something canceled. There's nothing different in terms of the proportion of what was canceled. Dentistry is still the highest that was canceled, follow-up visits and eye care. So even so, some of these like elective procedures are, and mental health, there's lower percentages. They still are impacting a large, almost 1 in 10 proportion of Americans. So more and more appointments have been canceled on folks. So we asked folks, all right, if you had a session, or excuse me, if you had an appointment or a procedure canceled, what did you do? And what's important here is among follow-up visits, consults, and mental health, a large proportion of these people said, I changed to a virtual visit. So again, no matter how we ask the question about receiving care, virtual visits pop to the surface. That is truly our number one opportunity for coming back and working with patients and getting that back in, is to have a virtual visit. You can see 45% of mental health, almost half of people receiving mental health therapy sessions in person before coronavirus, almost half of them switched because they don't want to miss those appointments. That's how important they are to them. Consult visits, 1 in 5. So think of the opportunity. Instead of trying to get everybody back in physically, because we don't have the space, we may not have the time, 24 hours in a day is all we have. The more we can adapt to virtual, that's going to ease the strain on those patients that physically have to come in. Maybe it's a procedure that cannot be done virtually. So anything we can do to ease the physical nature of people that have to come in, that's going to get them in faster. So there's all these opportunities and things we have to look at to move, kind of shuffle the deck, if you will, so that we can get everybody back in as quickly as possible. Because a lot of people are hurting. I'm sure you've read, we all know the stories of people not going to the ER with a heart attack symptoms or a stroke symptoms because they're afraid and they're dying at home. We can't have that. So here's a new question for Wave 2. We asked, what are some things that would make you switch? And this was quite interesting. We all think safety is the number one thing. It's really not. It's attitude and access. So if we look at the top two here, another provider can get me in faster. Time is the new currency. So they want to know you're figuring out how to get them back in proactively. Number 2, my current provider has been difficult to work with in getting me rescheduled. That's connected with access, but it has to do with attitude. And if you look at the third one below that, my current provider lacks empathy for my situation. So how our frontline staff, so wherever they're calling into, whether it's at the doctor's office, the hospital, a call center, what have you, those frontline people that are on the phone, they have a huge impact on whether we retain patients or not. So it just shows you attitude and access. Those are your mantras right there for retaining people. Safety is starting to move into what I consider a table stake, like it was before. I've done a lot of work on quality and safety. Consumers just expect that they're safe when they go into a hospital or doctor's office pre-COVID. It's no different than when we all get on a plane to fly. If you thought for 1 minute that plane was going to crash, you wouldn't get on it. You assume safety. That's why no airline has ever done an advertisement that says, we promise to crash less than everyone else. You will never hear those ads because it's an assumption. And the same thing with healthcare. So now with the coronavirus, people at first were like, oh, I'm not going to go near a hospital because that's dangerous. They're starting to wake up and realize, you know what, that maybe that's a safe place to be. So that's something we have to continue to say to people. Here's what we're doing to keep it safe, but it's not a differentiator to make them pick us and stay with us. What they want to hear is, you're getting me in faster, you're giving me options, I want solutions, and you're treating me well because you know that I'm hurting emotionally. And so we have to train our frontline staff not only to have the facts and to have solutions, but to do it with an empathetic attitude. And that's why I think we asked people, how would you prefer to reschedule? 2/3 of Americans said, I want to call as opposed to online, because I think during this time, they want to talk to someone because their answers are more complicated than switching a Monday to a Thursday appointment, like in the old days. So now they want to talk to someone. So not only is that person a skip, yeah, go ahead, Stewart.
I just want to give you an anecdote of one that supports what you're saying. So my wife went in for an elective procedure yesterday. It wasn't urgent. She's fine. She's recovering nicely in the other room over here. But exactly that, she felt safety was, we took her to the outpatient center, so safety was presumed. But also that, there was multiple calls, not much more than there would normally be. So that she, like, how does my husband pick me up? What's the process? Do I have to wear a mask? All those things, the preferring the call, whereas before we probably would have done it online. So it's just an anecdote of one, but just to maybe make it a little more human, you can see why people want to know the details. They're much more concerned about what's beyond the door, like what's actually going to happen. And she felt much better after talking to them on a number of occasions to figure that all out.
Yeah, I mean, that scheduler is almost becoming a part-time therapist in some ways. And this is our new normal, but it's also an opportunity. All crises create opportunity. And so I think not only with virtual care, but training our phone staff to really be our brand ambassadors is critical now. So then we asked a new question, how much concern do you have about going to the ER, inpatient, urgent care, outpatient, and doctors? And you can see that the ER is still the highest level of concern on average. And so that's something we have to continue to educate people with. I think, I'm sure you've seen the PSA that the Boston hospitals recently did and sent out to basically tell people, if you're having a heart attack symptoms or stroke symptoms, do not stay at home. We are safe in the ER. Here's what we've done to make it safe for you. You need to come in because this is life-threatening, and we are prepared for you. So we're having to retrain people to do not ignore symptoms like this. And people feel most safe at their doctor's office. Truth be told, we all know on the inside they're safe everywhere. Here's another opportunity where we can shuffle the deck, if you will. We asked people, if you had an inpatient procedure scheduled, would you switch to an outpatient center if that meant you could be seen a lot sooner? And 21%, 1 in 5 said yes, mostly 18 to 44-year-olds. So again, we can target those people. And if you can get 1 in 5 of your patients to move from inpatient to outpatient, think of the space that would open up and the scheduling that would open up for those that really have to remain an inpatient procedure. And then on the right side, another opportunity, it's not only where, but with whom. So about 1 in 5 said that they would be comfortable. If they could be seen sooner, they would see another doctor, either in their doctor's office or another doctor's office within the system, or they would see a nurse practitioner or a PA. So there is a there's an opportunity to not only shift location, but shift the caregiver that they would be seeing, because it's about time. Remember I said time is the new currency. People want to be able to get back into that schedule. So we have an opportunity to do that with these types of things. And you see at the virtual visit at the bottom, almost 3 in 10 said they would do a virtual visit. So there's so many opportunities to move people around to get everybody back in faster, because that's the key, is how quickly can we get back to a normal stasis, if you will. And then we asked a new question: what's their level of concern about rescheduling a procedure or appointment? And we're going to dig into each of these in just a second. But you can see a moderate level of safety concern, but the affordability, as we saw earlier, cost was number 4 in that earlier slide, and it has the lowest. Now, that doesn't mean cost is not a concern at all. It is for a certain segment, as we're going to see in just a few minutes. So how we innovate in helping people financially come back is just as important. So the level of concern is consistently higher with women and people 18 to 44. So as you're targeting any messaging, those two groups of consumers have higher levels of concerns across the board. No matter what question we ask them, their concern levels were higher. What's interesting is seniors, who are in more of the bullseye of getting the coronavirus, they're the least afraid of going back out. Maybe because they're older and wiser and they've been through it many times, they're ready to get back out. So it's younger people that are more concerned about getting back to normal activities. So that's important to understand. Age is driving a lot of this concern. So then what I did for each of those areas is we asked folks, what can we do as healthcare providers to help you to ease your safety concerns? Now, there's no perfect list. I'm sure I would add or change things in my next wave. This was based on talking with several provider clients. And so what we found was that basically, remember, 75% don't know anyone with coronavirus. So what they're learning is indirect from information they're receiving. So it's no surprise the biggest things they want to learn about safety are separation and PPE. Because that's all we're telling them. Social distancing and wear a mask and wash your hands a lot. So you'll see the top 5 safety concerns that they want to learn about from us have to do with how are we keeping people socially distanced. They want to see providers wearing masks and gloves, and they want to know that we're keeping any coronavirus patients that may still be in-house. We're keeping them separate. We're giving them a face mask and gloves to wear. Remember, people are nervous now, so their cognitive reasoning skills are impaired. So they're forgetting things. I mean, I think every one of us on the call today has gone out and forgotten the mask at one time, or can't remember where it is. So all of our cognitive reasoning is dampened a bit now. So for us to be the heroes, we need to be proactive and do the thinking for them. So if someone shows up, we need to be prepared and say, you forgot your mask? We got your back. Here's one. Here's gloves. We know you're struggling right now. We're here for you in all the little ways that they can't think of. It's just like the Ritz-Carlton. The Ritz-Carlton anticipates your needs before you even know you have them. We have to behave like the Ritz-Carlton now. We have to anticipate their needs because they're struggling emotionally, not just physically. So here's now cost concerns. So granted, if you look at these, not every one of these a provider can legally do depending on the states. So here's where payers may have to come into play. And so what are they looking for? They want us to either lower or eliminate their copay or deductible during this time. Others, especially those that have lost their job, if you look down at the 17 and 14, it's significantly higher than these scores among people who've lost their job. They want a payment plan or extend payment dates. I mean, look at the car companies on TV. They're saying no payments for 90 days. You see renters and mortgage companies are delaying payments. Other industries are delaying payments to help people. In healthcare, we need to take a look at how can we do that as well. I know we are struggling financially, but if we're going to prime the pumps, the bottom line is we need patients to come back, but they need our help to be able to come back. And part of that for a segment of them is financial help. And so for those that are in need, how can we get creative to help them come back? we've got to focus on revenue right now. We can't also be focused on profit immediately. I know that's hard to hear, but when you start up an engine, you can't rev it right away. It's got to warm up. We've got to prime our pumps with revenue and getting people back in. And that means if we have to help them financially, what are ways we can get creative to help them, whether it's extending payments, lowering deductibles. Again, we have to come together as providers and payers and work together and say, what can we do to help these people in the short term? So access. Remember, I keep saying that time is the new currency. And the number one thing that people want to ease their access concern is we offer virtual visits in place of an in-person if it's appropriate. And number two, extended hours during the week, meaning 6 to 9 p.m. or early in the morning. I've done a lot of work on scheduling in the past, and I have found too that people want extended weekday hours, not necessarily weekend. So if you're only going to do 1 week, extending your weekday hours is going to give you more bang for the buck. I've got clients that are starting to expand surgery. They're doing outpatient surgery up to 9 o'clock at night because they're trying to get caught up, if you will. We are in a catch-up mode right now, and so we've got to think outside the box. So you're seeing a lot of these opportunities are moving people around, having them see different types of providers, going virtual, extending hours, easing pay, all of these things we have to do to be relevant when we come out of this. Because it's important to understand what we do now will be remembered. So if we don't treat them the way they want to be treated now in a crisis, they're not going to have confidence in us afterwards. So stepping up our game now as a brand will ensure your success down the road, because you were there for them when they needed you. They're going to be there and loyal to you when you need them in the future. So think of now as an investment in the future. I just threw this in. It was interesting. I was reading Ad Age a week or two ago, and they had their top 5 consumer trends. Look at number 3 is virtual health. So even advertising folks outside of our world are putting us in their top 5 trends. So again, no matter how we talk about it, virtual health, it's here to stay. Then we asked, what's their preferred method of communication? Phone call, we've just been talking about that, especially as age goes up. Email is also important, proactively reaching out to them. For younger folks, they're more into live, online, interactive Q&A sessions, online provider social media. So what is your SEO, SEM strategy? Don't just put a COVID page on your website and expect everybody to come running to you, because they won't. They're going to the CDC, Mayo Clinic, Johns Hopkins, things like that, or WebMD. So if you want them to come to your website for information, you've got to get them there. So you've got to proactively reach out to them. So that's email strategy, SEO, SEM, having a strong social media presence, whether you've got a Facebook page or a Twitter that you're interacting with people, but you've got to reach out to them if you want to be that source of what's going on. They're not just coming to you on their own. Older folks prefer written format, if you look on the lower right side here, and younger folks prefer video. The bottom line is one size doesn't fit all. You've got to communicate multilingually, if you will. You've got to be able to email and to call and to have written statements of what we're doing, and you've got to have videos. You need all of that. So now is time to bring out all of your tools in your toolkit to communicate with people. So from a messaging standpoint, I thought it was appropriate to bring in FDR in his inaugural speech. And he said, Americans want action, and action now. So the key point for us is, don't tell people what you're going to do. Tell people what you're doing now. Let us show you how we are, or let us explain how we are doing this, or here's how we are doing blank. You'll notice the top 4 messaging that consumers wanted all started with the word explaining. So they want a cool, rational, level head about us. Let us explain what we're doing to keep you safe and to get you back on time and to work with you on costs. Here's what we're doing. That's what gives people the most comfort. It's not a message of we're all in this together. I can tell you all the ads on TV now, they're talking about stay strong, we're alone together. All those motivational ones, those are really wearing thin on people's nerves. They're getting sick and tired of all that kumbaya crap. Now is the time for action. And folks, that's a marketing term, kumbaya crap. So, but the point is they want action. And so we are in the best position to give them action. And so go ahead, Stewart.
No, sorry, I thought you were done. We talk about this internally a lot in terms of the confusion in the marketplace and how what to do as a consumer continually seems to lag. And then, so I can see why explaining and reassuring, but especially explaining, and you mentioned earlier, being the authority as the healthcare provider, because there's kind of a shrug of like, I don't know who to trust. And so if it's a local provider, I could see why that'd be super powerful, as opposed to soft, fuzzy messages at this stage, especially as people are tired.
Yeah.
So no,
absolutely.
We'll quote you on that one.
So let's talk a little bit about how local healthcare providers are handling the coronavirus. So it's local from the perspective we asked people, because it's a national study. Considering your local healthcare providers, how do you feel about them? This is not brand specific because we can't get that microscopic given a national broad study. So we asked folks, one of my favorite questions I developed 15 years ago on the chicken or egg. So we asked people, based on how your local healthcare providers are handling the coronavirus, how do you feel about them? So you can see about 4 in 10 said it reaffirms my existing positive feelings. Another 1 in 5, 20% almost, said it created new positive feelings about them. Very few people said existing or new negative feelings. So you are creating a lot of new fans. That's why they're using the word hero. So the opportunity for us as marketers to really help come out of this is never been, the opportunity has never been greater. Then we asked, how much confidence do you have in these different types of people or organizations? And with my doctor or my preferred hospital, that confidence level is significantly higher than it is for pharmaceuticals, retail clinics, and health insurance companies. And so that's something I've seen for years. I've done a lot of work with all of these different companies over the past 30 years, and no surprise, the provider tends to be endeared with that person the most. And so as pharmaceutical companies and retail clinics and insurance companies, you've got to make sure what you're doing is what you can control to make sure you're saying, here's what we're doing to help you financially, or here's what we're doing to have you come in to our clinics to keep you safe, and we're getting you in fast. Pharmaceutical companies, here's what we're doing to lower the cost of drugs. So everybody has a role, and they have to play that role. They can't play outside their role. And for a lot of these companies like pharmaceuticals and insurance, cost is unfortunately, it's a big part of their role that they have to play. And so working with providers to help patients come back financially is critical. Now more than ever is the time for what I like to call co-opetition. There's competition, but there's also cooperation, and it's called co-opetition. And we need to have that across our industry more now than ever. So how are healthcare providers handling all these different things? The arrows again indicate a significant increase from wave 1 to wave 2. Here's the bottom line. Our opportunities are, we must provide options, or like I call them solutions. We have to learn fast, and we have to be empathetic. Remember, a lot of folks in Silicon Valley talk about, as high tech, we have to fail fast. Well, I think in healthcare, we have to learn fast. That's our mantra, is learn fast. So our opportunities are solution-oriented, meaning we're proactive, we learn fast, and we're empathetic. That has to be our driving mantra. So we also asked folks, have any local healthcare providers done some innovating that's impressed you? And 27% said, yeah. Then I asked them in an open end, well, what did they do? Virtually every, no pun intended, virtually every single verbatim talked about virtual care or telehealth. And then we asked them, should we keep doing this after the coronavirus? Now, the concern is it's down a bit from wave 1 to wave 2. So there's a segment out there that's not sure if we should keep doing that. So we can't just accept the fact that virtual care is here to stay. We still have to double down and continue to message and convince consumers that virtual care is a long-term solution to access, not just a short-term fix in the heat of the moment. So we've got to transition with consumers as they come out of the heat of the moment. we need to transition in our messaging to say, this is a long-term fix to access, because again, time is money to them. So social media and website visits. So we asked folks, what websites or social media have you gone to during the coronavirus, and which one's has been most helpful or useful to you? The CDC website, by far, number one. It was the same in wave one. And then you see WebMD and Mayo Clinic. But a lot of people are going to Facebook, group and friends, Twitter, but you've got about 5% said that they've gone to their hospital or system Facebook page, and then 10% have gone to their preferred hospital or system website or their doctor's website. And about half of them say that it was their most preferred. So you're in the mix, but just as many, if not more, are going to regular Facebook and Twitter outside of your control. So again, the opportunity is to have a stronger direction into that, meaning SEO and SEM and email campaign. So you've got to guide people to your website, because for the most part, they're not getting there without your guidance, or they're going to your website for something else, and they happen to see the coronavirus page, the header you have on your homepage, and they're clicking on it. So many of them are, what I'm finding in my website research I'm doing outside of this omnibus, is that people are getting to the coronavirus page on a website by accident. It's there, so they click on it, but they weren't there for it. So we want to direct more people there. Then we added a new question: how are people ending up at the website they got to? 36% most went directly there, but that's mostly the CDC. Search ended in WebMD and Mayo Clinic. So again, search is in our control. Social media, they're ending up at Facebook, Twitter, or the hospital and system Facebook page. Word of mouth is bringing more people also to the preferred hospital or system website or Facebook friends. So you can see where they're going is being driven by different sources. So lastly, here are some of their emotions and concerns. What's important here is that negative emotions are starting to abate. So loneliness, anger, fear, and anxiety, those levels are down significantly. The challenge is they're still significantly higher among women and those 18 to 44. So again, understanding that those two groups of people, their emotions are still a little higher on the negative side. And if we look at levels of concern regarding all of these different elements, they're down significantly for my financial concerns, my personal safety, providers' ability to care for me if I get sick, my overall physical health, managing other health conditions, and availabilities of prescription drugs. Those concerns are already starting to decline, which is a good thing. We want those to get to zero. Again, women and those 18 to 44, their concerns are higher than older folks and men. So let's get to the key takeaways here. There's never a better opportunity to build on the goodwill that you've instilled in consumers, on patients, to grow your brand. Now is the time to really plan for what does it look like when we emerge? Because we're going to emerge. This is not going to go on forever. If it does, then that's a whole other reality that we have to deal with. But we have to make the assumption that we're going to get back to some new normal. And whatever that looks like, we don't know yet. But we need to really make sure our brands are in a proactive, strong position to start communicating and bringing people back in. We've just proven to everyone that we can innovate quickly, and now they will expect us to continue innovating. In other words, our new normal means we can't go back to our old ways. Number three, there's definitely an opportunity to change behavior regarding where and with whom people seek care. So let's take advantage of it. Let's plan that. You know, again, it's being proactive, not reactive. Let's reach out to people to shuffle the deck as opposed to them calling and saying, oh, can I change? Because then we're more in control of our scheduling and we can optimize getting people in. Position virtual care so that the primary care physician is the hero. I do a lot of urgent care work outside of this. And what I have found is that urgent care, whether it's physical or virtual, urgent care is plan B when my doctor fails to see me. So many people think if they have to go to an urgent care center or go to virtual care, that their doctor failed them. So that's a brand ding on our physicians. And so what we need to do, as if you are a system, you have physicians, to help them be the brand hero, is to proactively educate them on how to convert people not only to PAs and NPs, another doctor's office, but to virtual care, so that it looks like we're being proactive and saying to patient Rob, you know, hey Rob, I know I can't see you right away, but we've got options for you. I've got solutions. You can see my PA, you can go to see another doctor in our network that I'll set you up with, or we can do a virtual care. All those will get you in immediately. But I'll know you had that visit, and all your patient records will come back to me. So I've got your back. So by doing that, we've now made the physician the brand hero, not the bum that failed the patient. So it's not only having virtual care, it's how we message it that makes all the difference in the world. So don't think you can just say, oh, we know how to do virtual care, we're done. You're not. That's just the physical element. How you position it with consumers, as well as how you educate physicians, that's where you will be successful. Because how we position and talk about things makes all the difference, regardless of the brand that you are. And then number 5, our new roadmap. Provide options. We're solution oriented. We learn fast and we're empathetic. And how do we keep patients? All about attitudes and access. And then lastly here, levels of concern and negative emotions are beginning to abate, but again, women and younger people. So how do we target our messaging, especially to younger people, recognizing that older people, they're ready to get going. You know, they've been around the block before, so they get this, they've experienced this before. But how do we address the concerns of younger people? Safety, it's all about separation and protection, just like we've been taught. Costs, how do we get creative in working with our payer providers, our partners, if you will, to help people that can't afford to come back? How do we help them to come back? There's got to be creative solutions when it comes to costs. And then access, virtual visits and extended weekday hours, as I mentioned before. Our method of communication, one size does not fit all. We have to be multi-method. And again, it's being proactive in driving consumers and patients to your site where they can learn a lot of information, but it's also giving information to them, whether you're sending them a video, sending them emails, calling them proactively. How are you doing, Rob? I know we're scheduled. Here's what we think we can do for you. Again, it's being proactive when they're in an emotional state. And then messaging, as I said, to quote FDR, Americans want action and action now. So focus on, let us explain how we are doing this, or here's what we are doing, not what we're going to do.
Fantastic. Rob, it's so much fun having you join us again, as we always have. And just for those of you that are listening that may be new to this, Rob and I, beyond being Palm Springs aficionados in mid-century modern style, we both have places there. Rob is our go-to researcher. So if you're interested in research for your institution or for your hospital or system or whatever, I work with Rob on everything that we do, and Rob's a personal friend as well. Rob, it was certainly fun having you. We have
Thanks, Stewart.
Yeah, for sure. We have a bunch of questions, it looks like, and Kyle's going to read some of them in a minute. How are you on time? Because I know we're already at 9:53 here in the Pacific time. Do you have a few minutes to go over if we?
I've got plenty of time. You're just keeping me from my lunch, but I'll survive.
It's breakfast time over here. So, okay, great. Before Kyle reads the questions to us, so hopefully Kyle's listening in, I did want to comment on a couple things. One of the things that's really intriguing was the idea about the emotions are beginning to settle in. And our creative director has been talking a lot about how people are going through stages of grief. And so, because the whole Kubler-Ross model of denial and
right.
all that. And I think that's probably what we're seeing. But there's still a lot of grieving out there, as evidenced by the mental health visits. So that'll be really intriguing to watch. You've been doing these kinds of surveys for a long time. Is there anything that's special that, because obviously can't ask everything, but do you have any additional insights on that? Or you said it was also women that were still more in the negative emotions. Anything else that you think we could learn from the data here?
Well, the challenge is that I struggle with, and why I'm doing multiple waves, is what are people going to feel like a month from now? That's why I think we're learning now, but we also have to be flexible, because everything we just talked about, how I think there's some things that are going to stay the same, and I think things are going to change as their fear levels decline. And so I think being flexible and adaptable. That's why when I said learn fast, I think that's everything right there. Because if we don't learn fast, we're going to be constantly playing catch up, and we may never catch up.
So very good. And I've got another comment before I turn the ball over to Kyle, but I do want to bring up, for those, if anybody does have to leave on the hour, if we go a little bit long, this recording will be available and you will be getting a link, and the slides will also be available. So any of our attendees, don't worry about that part. We'll provide that to you. Another thing that's really intriguing to me, Rob, was the whole pharma. And it's interesting that your research, and maybe it's in the way we asked the question, because there's some other evidence from other providers that pharma is receiving a bounce, because they're seeing, suddenly like, oh, we do care about vaccines. Suddenly, oh, we do care about, because, pharma's had some black eyes over pricing and especially pricing and the opiate epidemic and those kinds of things. And I have seen some research. So I guess maybe what your research shows here, they didn't get as much of a bounce. Maybe it's because they're not on the broad basis, people feel more favorable, but on the, as it relates to me, they're not seeing that. What do you think might be happening there?
Well, it's hard to tell. We only asked that one question. So to be fair to them, it's literally one question, because my focus on this is because all of my clients are providers, hospitals and health systems. That's been the focus of my survey over the past two waves. So when it comes to pharma, I have only what's in that. So if they're changing what they're doing, I'm not capturing a lot of that. Maybe that's something we add for wave 3. That could be an interesting, cast a wider net. So
it is interesting because it's I can see why it wouldn't show up in the way you asked the question, because again, it was very personalized, but overall there's at least seeing some bounce. So it's really intriguing. You're right. This is a moving target. So for example, I spoke with my daughter who's 16 the other day, and we were ahead of this a little bit. We ended up going virtual about a week early because I have some friends and scientists who sent me data to look at. We went virtual hours later, so relatively early into the pandemic here. And so I remember talking to them about what we're about to go through, and you can imagine as a 16-year-old girl how exciting that is to be, cooped up at home for, an indeterminate amount of time. And so yesterday we spoke again about this because, there was when they started opening up the states, everybody's like, yay, we're over. And then it's like, well, maybe not quite so fast. And so we're already talking about whether we'll go to school or whether she'll be able to go to school in the fall. And that's definitely not clear at this point. And so as new data comes out almost every day, it is an emotional seesaw for people, right? So we really know what's going to happen. And so I urge those of you that are in the business with Rob and me to, keep your ear to the ground, and you have to use some instinct, be guided by the data that you're seeing, try to absorb news from a variety of sources so you get a better perspective of, you may think this news source is incredible or this one is, but to understand where patients are coming from, because it is really across the board and it is dynamic. But Rob, again, this is great. I love that you're doing a series of these because I think that's really necessary. You've got a baseline of data that you can refer to on multiple omnibuses and then omnibus I don't know. As well, like you're going to see maybe new nuances that you'll be able to drill down into the next time. So Kyle, I've got some time too. Why don't you ask some of the questions we've got here? Looks like we've got a fair number.
Yes, we do. Indeed, we do. So the first question is actually from a couple of different people. It is regarding the actual research that you did, Rob, and several people are asking, once again, if you could recap what the sample size is for these questions, and also how you chose these particular people, and also demographics of those people, if that's something you could share.
Sure, thanks. Yeah, so again, it was an online survey of 500 consumers across the United States. And we, as with all of my online research, we use a panel company that provides consumers that agree to take surveys, and then they get financially compensated for that. So we basically send our survey link to the sample partner that I've worked with since I've had my company 16 years ago, and then they send a random sampling of their panelists around the country to take our survey. So that's what I do with all of my brand studies, my advertising studies, all of my regular, if you will, client and partners market research. I've moved most of my clients that I can to online because telephone is really struggling as a methodology, and eventually is going to be almost unusable in healthcare because of how small our markets are. So that's the methodology. And so from a demographic standpoint, I have all those demographic slides in the main report. This is just a presentation. So Stewart, maybe you can make the report version of this available, because that has all the demographics at the end. I changed things up and shortened it a bit to do this presentation for them. But the report is either available on, they can grab it right off my website, or you can send it to them. But that's easy to answer.
Yeah, send me the comprehensive report. I'll share that on the slide deck and then the video as well.
Yep.
Great.
You got it.
Fantastic, thank you. Another question here from Andrew is, what do you think about virtual urgent care, and more specifically, branding virtual urgent care as a primary care doctor?
Awesome question, thank you. Oh, great, because I'm doing a lot of urgent care, and urgent care is a critical strategy, whether it's physical or it's virtual. And branding it as yours is absolutely critical, because, you know, as you look at brand architecture, I do a lot of brand consulting, and, you know, do you want to be a branded house or a house of brands? And when you have separately branded things like your virtual care, it's another mouth to feed. And then people don't know it's you, so you're not getting any credit. So I'm a real big believer of branded houses as an architecture strategy in healthcare, because we're all becoming systems in some fashion. And so you want that master brand to get credit for having that virtual care, so that people know, oh, I'm still within the same family. That way you get the brand credit for doing that. So I think an urgent care strategy, whether it's physical or virtual, if you don't have one, you're way behind the 8 ball, and you've got to brand it so that it's connected to the master brand. Yeah,
I would add to that. We do a lot at Healthcare Success, a lot with urgent care as well. And a couple of things that I would add to Rob, because I totally agree with you. One is we talk a lot about in our seminars in different places. Everybody thinks marketing is, you know, the one of the P's, right? Promotion is like, that's marketing. And, you know, you could argue there's at least 7. We talk about price, product, place, promotion, people, positioning, and packaging. There's 7. Different models have different numbers, but it's only 1 P. And I would argue that the first step in marketing is your product, right? And so today with urgent care, telehealth is merging, so it's another product within a product. And so you have a you know, pure plays like Teladoc, which is just a machine. They were big before, and I think I just saw they grew 30% or something this last quarter, which is not surprising.
Should have bought stock.
Yeah, I'm sorry.
Should have bought stock.
Yeah, I know. Yeah, exactly. And it's like, it was so predictable. And they have been growing like crazy. And they've been quietly eating provider lunches for a while. But now it's, you know, it's a huge shift. But then, you know, like, to me, if you're going to be staying, so coming up, if you're deciding to be a pure play in that arena, that's tough, because they've got a big head start. But, you know, it reminds me as well of financial services. So for example, I'm using currently Schwab for the 401k and all those kinds of things. And, you know, it's mostly virtual, but and in fact, the advisor I have is in Texas or someplace, but I have a physical advisor as well. It's kind of a hybrid. So I want to have somebody that, you know, is there physically. It's nice to know there's a branch, even if I'm doing most of the work virtually. So I think that may be what we see with urgent care, that it's really a combination. And I can remember once when I had the flu, and I called the doctor's office and said, never mind, I'm not coming in, I'm too sick. They, what do you mean you're too sick? It's like, oh my gosh, I can't drive 20 minutes. And so there was an example where telemedicine would be perfect, right? You could get your Tamiflu prescription, you don't have to go anywhere, but you still have access. And I think that's where the future is going to be, especially with local providers, is a hybrid approach where they can either brand it as part of the same thing or have a separate brand, but for sure having a strategy there, not just a tactic reaction, is really vital. Next question, Kyle.
Sure, yes. This one is for Rob. This is from Rebecca at Arkansas Children's Hospital. We recently launched
Rebecca.
We recently launched a We Are Open campaign. We're doing social, paid, print, and all the things. Do you think our patients and families need to see how clean and safe the hospital through video or pics are, or hear how clean and safe the hospital is through Facebook Lives, podcasts, etc.?
Yes. So basically, yes to all of those. As I mentioned before, different people take in information differently. So one size won't fit all. You can't just do a video or just do a Facebook or just do an email. Unfortunately, you need to do all of those things because some people get more by hearing. Some people like to see, seeing is believing. Other people want to read it. So we all have different ways that we learn and process information. So I think you need to do all of those things so you can capture all of the parents. And I know you guys well and love your brand, and you're doing a lot of the right things. So continue to do what you're doing. Show people pictures of how you're keeping it clean. Tell people. Send them emails. Again, there's different ways they want to learn.
Excellent. Good advice. What else?
I have another question here from Amanda. And she says, while some health systems like ours have shown we are the heroes, having seen more and treated more COVID patients than any other hospital, people's perceptions have truly increased. However, how do we address new messaging to get them back in when this is the perception?
So if I understand the question, is there a concern that it's a double-edged sword that, wow, you're amazing because you've seen more COVID patients than anybody else, with, oh, you've seen more patients, that makes me afraid to come in because how can you keep the place clean? So if that's what your question is, and I'll assume that's what I call a double-edged sword. You're great that you're doing that, but I don't want to go there. So again, your messaging then has to be, here's what we're doing. Just explain. Yes, we've seen more and we've done a fantastic job handling it. Here's how we are adapting to take non-COVID patients. Maybe even though you saw a lot, your numbers, I'm sure, or hopefully, are going down. So you're not at the levels that you were earlier. So you can demonstrate how, show the numbers. Here's how they're going down. Here's where we're putting those patients. Here's how we're social distancing them. Here's how we're cleaning any place where they've been. Everything is perfectly sterile here. You are safe coming here. And here's what we're going to do to get you in and to get you treated and to get you home safely. So again, it's not, don't feel bad. Don't feel like, oh, I'm sorry we treated so many. Gosh, can you ever forgive us? Don't feel bad. Own that you've done a great job. Own that and be proactive and say, here's what we've done. Here's what we're doing to make it safe. Just like it's a fact. Because, just like, hang on one second, Stewart. Patients are like kids. When they fall down and skin their knee, if the parent freaks out and says, oh my God, then the kid freaks out. If the parent's like, oh, you're fine, just get up, the kid thinks they're fine. We kind of have to treat patients a little bit that way. We've got not dismissing their fears, but not rising them up. So own the fact that you've done a lot of these care, and here's what you're doing to transition to non-COVID, and we welcome you back. Sorry, Stewart, go ahead.
Excellent. No. I was going to say it's excellent input. I think that first of all, one of the things is the communication, and I have no way of knowing if you're doing this already, but especially for elective surgeries, which is where so much revenue is driven, is if you have an outpatient center, because they may not know that. So a lot of times it's kind of like, do fish contemplate water? Well, of course they're at the outpatient center, but the patient may not know that. So if you have an outpatient center where, no COVID patients have been, that's very reassuring. So, and obviously you want to have the safety measures as part of your part of your communication strategy. But for sure, if it's been outpatient, because I think that's a big deal. It was for us. We went to our elective procedure yesterday, and it was very reassuring that this was not where they treated the COVID patients. Number two, I think that in addition to what Rob said, it's really important to recognize that there is some patients will perhaps keep that in mind more than others, but as you pivot your messaging to be more about the future, and a lot of the stuff that Rob talked about today, taking that health leadership position about, now, and I'm making this up, obviously, we haven't been consulting with you, but how, we as a community are safer, now that we're entering this new phase. I think all those nuances may help. So I agree with Rob. That's a little bit of a nuanced question, but there's some solutions there for sure. Excellent input there, Rob, for sure. Kyle?
Thanks.
And yes, and actually Amanda just sent another question or just a little comment, said, yes, you are correct, Rob. We are still not able to fully open as the shelter in place is still in place for the hospital she's working in, Mount Sinai. So that is correct. Let's see. Another question here from Lee. He said, maybe I missed it. Did the research also address use of a healthcare system app or a website to access a patient's personal medical record or EMR?
Yeah, we did have in there about accessing an app. So that is definitely up. It's still low relative to others, but hospital, downloading a hospital app is definitely up. That's one where I'm not sure if it's going to continue. I know we're all racing as providers. We're all racing to have an app. And so we have to make sure that we're not doing it because it's that shiny object that everybody else has, but there's a legitimate reason because we want to make our patients more like members of something that is important for them to be part of. And so the app has to have legitimate value. But that definitely right now, that seems to be tracking up. But again, I want to watch that over time to see if that continues.
Looks like everybody's staying with us, Rob. We have most of the audience we're spellbound here based upon the numbers I'm seeing. So
or they have nothing else to do. I don't know.
Let's see. Another question from earlier on was, what were the dates for wave 1 and 2 in your original research?
Yeah, sure. So the wave 1 was done April 1st to 4th, and wave 2 was May 2nd to 4th. So exactly 1 month apart.
That actually looks like it's about it for now, Stewart.
All right, we're getting some compliments now in the chats as opposed to new questions, so that's great. Hey, Rob, as always, totally fun to talk to you. Hope to have dinner with you at our favorite destination soon.
I hope so. And Stewart, I'll keep you posted on when I'm going to do wave 3 because I'd love to come back and do this again with wave 3 with everybody.
No, that's fantastic. I was hoping you would say that. I didn't want to ask, so I'm glad you volunteered. I love having you
Absolutely.
on my podcast/webinar series. Again, Rob's a long-term friend of ours. He's a leader in the industry. He's my go-to, so I can't speak highly enough about my experience working with Rob. I share him with my clients, and then of course we have our own company here. So if you have any questions, just get back to us. We will be sending a recording and a link to the entire slide deck, which is much more than we could have covered today. I do think it's critical to recognize that today's webinar, there goes my dog. Welcome to Home and Drink Hope. Come on, Cosmo, we're working here. Was the idea that you really brought the slides to life. I looked through the data, obviously, prior to the meeting today, and we talked a little bit about it, but your comments just bring this to life in such a great way. So I do hope that if you have colleagues out there that you're going to refer this webinar to, I encourage them to not just look at the slides, which is something I probably would do. I'm always so busy, but those insights in between the lines are huge. Thank you again, Rob. We'll tell Cosmo to shut up, and I'll see you next time.
All right. Take care, everyone. Bye now.
Bye, guys.